far.
I know this building very well. I used to work here. Many years ago, Dr. Dawkins and I worked over in the office over in that corner over there. At that time, it was called Miners Clinic. We'd originally bought the old Miners Hospital on Zion Street and outgrew that facility. We moved into this facility here, Whispering Pines, and it continued to grow. And it morphed into something called Western Sierra, which is now on Old Tunnel Road. Now this building has gone through many iterations over the years. But today, we rededicate this building as a place of restoration and for healing. I'd like to welcome you all to the best of Nevada County, a public-private partnership. Sierra Nevada Hospital, Brian, Kimberly, Sierra Nevada Hospital Foundation, and Nevada County Public Health, which I'm part of. I personally want to thank Kim Blix and Laura Zeman. They're the ones that had the idea of this, because our public health building is just right up the road, and every day they would pass by here, and they thought, would not this be an excellent facility for immunizations? And I want to thank Kimberly, thanks, and Brian and Rob for their support in bringing this building to fruition. Now this is an example of how we can collaborate to produce a facility for not only immunizing the residents of Nevada County, but providing a vehicle for protecting and restoring the health of this whole community. Thank you very much.
And I'm frankly delighted to see this partnership between Nevada County and Sierra Nevada Memorial Hospital put this facility together in a timely way so that we could start to provide more vaccinations for this community. The logistics of this were challenging, but it came together relatively quickly. This is a building that Sierra Nevada Memorial Hospital owns, and we really did need to put a lot of resources into making it vaccine clinic ready in a big hurry. And we had some help with that from some of our local community partners. Kimberly Parker, who is the executive director of our foundation, the Sierra Nevada Memorial Hospital Foundation, was very instrumental in making that happen. We also had some help from the Rotary, just cleaning up the area around this clinic. And so what we really need to do is turn this clinic into a regularly occurring vaccination center that has a cadence to it so that we can predictably provide vaccines on a nearly daily basis for our community. The biggest rate limiting thing for Nevada County has been just vaccine supply, and we just need to get more vaccines into the community, and then as soon as we have them here, we get them into arms. And that is really the way forward for our county and really for the country with regards to this pandemic. I've been giving vaccines all day today at the hospital for folks that are over the age of 75. It is incredibly gratifying to provide people with some hope to move forward from this pandemic. The majority of the people I was seeing today have been stuck in their homes basically for a year. People told me stories of great-grandchildren they have not met. It's been that kind of an experience for just about everybody. Everybody has experienced loss this year, not seeing graduations they thought were going to happen. They didn't attend weddings they wanted to. Many, many different stories, and we all have those ourselves. So I'm frankly delighted. It's an emotional day for all of us because I think we really have some hope for the future. We'll get more of these vaccines into folks. We'll get to a point where we can reopen our lives, and I'm really looking forward to that. And I think Dr. Kellermann already committed to purchasing all the beer that we need at the fairgrounds party that we're going to have when we all have achieved herd immunity. So I'm looking forward to that. Thank you, Scott. Appreciate that very much.
Thank you, Brian.
Yeah.
I understand you get the beer, I get the beer, you get the champagne.
It's times like this that I think we really realize what makes our community special and unique. You know, you have a really hard time, I think, coming together quite like this with all the different partners that, you know, had to be brought in very quickly to make something like this happen and make, you know, this project a reality. I have to really commend the plant operations people at our hospital, because when we approached them, you have to understand, they were still working with surge tents and emergency things, and we were in big storms and everything. And, you know, originally we were looking at, you know, getting the building turned around. It needed some repair. It did not look like this a couple weeks ago. It had some blemishes in it, let's just say. But not only, you know, did they stand up to the challenge, but they got streamlined construction to come in, and originally I think had a 2-week, and asked them to turn the building over in a week, and they did it. And so that's, you know, really amazing. I also have to really acknowledge 49er Rotary and Grass Valley South Rotary. They were the 2 clubs that came over. Again, if you had been over here and saw the parking lot, and Scott was here, and you know, the flower beds and everything, they really kind of came in and just swept everything up. As Scott said, public-private partnership that works really well. As I stand in the force to be reckoned with in Nevada County.
Indeed.
People who come here, we had a whole room full of people right here waiting to be seen and to get their shots. And it was like old homecoming. You can really tell you live in a small community, because everyone's like, oh, I haven't seen you forever. Oh, how are you doing? Whether it was the fire chief and some of his staff, or the policemen, or teachers, or community neighbors. People were just delighted. So we register people at the front. Starting next week, they're going to do all the paperwork online, myturn.ca.gov. So we won't have to do much with papers. They'll have appointments. We can see people every 10 minutes. And we're going to have, we have 5 hired state nurse and LVN vaccinators coming, as well as 4 administrators. So this staff is going to get oriented the day after President's Day. And then from there, we're going to go to full capacity. We're going to be using Pfizer vaccines, and we can see up to about 1,200 people when we're in our full capacity per week. So as Dr. Kellermann said, we're just waiting for the vaccine. And as that gets ramped up, hopefully throughout the country, then we will also be able to keep up with that. And hopefully vaccinate everybody who wants it, and then some people who are waiting to see how their neighbors are doing. We're doing a lot of education. Having 15 minutes with people in the waiting room is really nice, because I can say, do you have any questions? Here's some information about the vaccine.
Looking in 2 weeks, what we put together here. So incredible, and thanks to Rotary, the Foundation, and hospital, and the media. You know, this is so important for the media to spread good news. You know, we hear sad things every day, but this is exciting stuff, so I look forward to seeing the hustle bustle here. And again, thanks, Dr. Kellermann. You didn't have to be here either. You know, you put your foot into this little battle, and kudos to you. You know, that was a big step. You didn't have to do that, and we're so glad to have you on board.
Yeah, I remember your dad. He stepped up to the plate.
That's what this community is about, stepping up to the plate. Yeah, so thank you all again.